Can you heal your amygdala to recover from PTSD? Imagine your brain as a busy city where different neighborhoods handle different jobs. One small but powerful part is the amygdala, which acts like the city's alarm system, detecting danger and triggering fear. In people with post-traumatic stress disorder, this alarm system often becomes overly sensitive, sounding off even when there's no real threat. This can make everyday life feel like walking through a constant storm of fear and anxiety. Now the question is, can you change how this alarm system works? The answer is yes, but not in the way you might think. The amygdala itself is a tiny part of your brain and cannot be physically repaired or regrown like a broken bone. However, the way it functions can be influenced and changed over time. Cognitive behavioral therapy, or CBT, is a common treatment for PTSD. It doesn't directly target the amygdala to fix it, but it helps the brain respond differently to trauma-related thoughts and feelings. One key part of CBT is exposure therapy. This involves gradually and safely facing memories or situations that reminded you of trauma. Over time, this helps the brain realize these cues are not immediate threats, which can reduce the amygdala's overreaction. Another important part is cognitive restructuring. This technique helps you identify and challenge unhelpful thoughts about yourself, others, or the trauma. By replacing these with more realistic thoughts, you can lessen emotional reactions, which can influence how the amygdala responds. Education about trauma and stress management skills are also part of CBT. Learning how trauma affects your brain and body helps you feel more in control. Relaxation exercises like deep breathing or mindfulness can calm your body's stress response, which is closely linked to the amygdala's activity. Research shows that after successful CBT, there can be measurable changes in brain activity. For example, studies have found less activation in the amygdala when processing fear after therapy. There is also improved communication between the amygdala and the prefrontal cortex, the part of the brain responsible for decision-making and emotional regulation. These changes are linked to fewer PTSD symptoms and better emotional control. It's important to remember that everyone's brain responds differently. Some people may see quick improvements, while others need more time or additional treatments. But overall, CBT is one of the most effective ways to help your brain manage fear better. So, while you can't physically heal the amygdala like fixing a broken part, you can retrain your brain to respond to fear and stress more healthily. This process can lead to fewer symptoms and a more balanced emotional life. The focus is on changing thought patterns, reducing avoidance, and building skills that help your brain function in a calmer, less reactive way.